Thank you for tuning in to The Truth Talks. Today I'm joined by Gwen Olsen. She's an author, speaker, and health activist who's a former employee of the pharmaceutical industry. Today we're talking about her perspective on pharmaceuticals after working in that industry for over 15 years. Thank you for joining me.
Thank you for having me.
So, can you just let us know, I guess, a brief look at your background and what eventually is maybe the turning point that got you out of the pharmaceutical industry and where you are today as a health activist?
Okay. Well, I started in the pharmaceutical industry in 1985, and I had a 15-year tenure in the industry and left in the year 2000. It was after I'd been in the industry for a period of time that I was in the midst of a divorce, and I went to see my general practitioner. And of course, I had become a little despondent and depressed because I was going through a divorce, and I was losing weight. And it was at that time that my practitioner recommended that I take an antidepressant. And I had never taken any antidepressants. I had been previously on anxiolytic drugs for many years and wasn't aware at that time that some people are predisposed to having adverse events if they have been long-term on benzodiazepines and then they institute other psychiatric drug therapy. I was not aware of that because I'd never sold that category of drugs, and therefore, just like a lot of other people, I had no education around it.
And your doctor didn't ask about that or didn't mention that to you?
Well, my doctor was very well aware of what other therapies I had been on, so he was not aware of the information. Okay. He was not aware of the adverse event potential. So, long story short, I started reacting to the first drug that I was put on. And within a couple of days, I had racing thoughts. I wasn't able to sit still. I was becoming severely anxious. And so I called my practitioner and told him that, I was having adverse events. And he said, well, these kind of adverse events don't appear in the package insert, so I don't think that's actually what's going on. I think what you have is called agitated depression, and we need to double the dose of your drug. So being a compliant patient, I doubled the dose of my drug, and at that time I became manic psychotic. I developed what is known as akathisia, and that is a Greek term that literally means can't sit still. It is an internal trembling that it's so severe that at some points I was actually laying in a fetal position trying to keep myself from shaking so badly. Mm-hmm. And it is so disquieting that it is what drives a large number of people to commit suicide, quite frankly. So I called my doctor back again and tried to explain that, what was going on with me. And of course, then I was told that I was not depressed, that in fact, because I had exhibited this manic response to the drugs, that I was in fact bipolar and that this was part of the bipolar spectrum, and that I was going to have to be put on mood stabilizers and other antipsychotic drugs and antidepressants and all of these different categories of drugs. And of course, I was devastated. I was devastated because I had begun my journey as a mental patient. And I was very well aware of what that consisted of because I had been selling haloperidol for one of the pharmaceutical manufacturers. Wow. And haloperidol, if you don't know, is one of the older neuroleptic drugs. It was previously reserved only for psychosis and schizophrenia and things of that nature. But of course, it began to be utilized for mood and behavioral control, as well as a sleep aid and things like that. Mm. So I had firsthand experience having been in the psych hospitals, having been in the nursing homes, having been, mm-hmm. in the mental health, mental retardation facilities where these drugs were utilized and sold. And I was aware that, now I was one of those patients, and I had to deal with that psychologically as well as the emotional and physical ramifications of taking the drugs and having adverse events. Mm-hmm. I literally was brain damaged. And that was probably my impetus. That was my starting point for a greater understanding of what I was doing professionally, how the drugs that I was selling were affecting others, because a lot of people aren't aware, even the doctors who prescribe these products, of what they do to you personally if you haven't experienced it.
Right.
So I think that was part of my journey, for me to have that personal experience, so that I wasn't speaking from, a book learning base of knowledge. I was speaking from my own personal experience.
Right.
And of course, I went through several years where I worked part-time. I was trying to heal. It was very difficult for me to maintain my profession because I would forget things. It was my cognitive abilities were affected. My memory was affected. I was literally brain damaged to a degree that I had to live out of a Franklin planner because I was scared to death I would forget something and, fall short of my responsibilities, or that I would get fired. And then eventually I had to move to a part-time position because I could not handle the stress of the full-time work any longer.
And were you still on the medications over the course of these years that you're talking about now?
As far as the antidepressants were concerned, no, I was no longer on the antidepressants. Once that I recognized that the drugs were in fact the problem and not the solution, because see, having sold the drugs and having had an education in all of this stuff, I was more aware of the side effect profiles than even the doctors who were prescribing the drugs. So when I was coming up with things that were clearly side effects and being told that they were not, that they were symptoms from my disease state that I had been diagnosed with having, then I realized that I had to stop giving my power away to these so-called authority figures whom I was more educated than on this subject matter, and to start being proactive for my own health purposes. So go ahead.
No, I was just going to say, what really becomes apparent as you're discussing that, there is that essential question, when we experience emotions or a behavior, there is often people will say, oh, well, you're experiencing that, as you said, because of the disease, because of the underlying disease. But here you have a very clear situation where prior to use of the drugs, you were not experiencing those things. Immediately after the use of the drugs, suddenly these things are happening. And as you stated, because you had a thorough understanding of the different side effects and things like that, often in cases more so than the doctors even, that you are actually able to recognize that as it's happening to you and see what it's like to be on the receiving side of these drugs.
Right. And to see how that the doctors actually, this was someone that I had known not only as a physician, my own personal doctor, but someone that I had called on professionally that knew what my knowledge base was, and how that he insisted I defer my personal power to him and follow his instruction, even though it went against the grain of everything that I knew to be appropriate. For example, I was on a cocktail of different drugs where they initiated one therapy. When that therapy, I started to react to that. Of course, he told me to double the dose. I did that. I got more toxic. And then they changed the drug. First, he said he was going to add another drug, but I refused to put two drugs together because I knew I wouldn't be able to identify without a washout period. And of course, I wasn't offered a washout period, which what a washout period is that once that you institute one psychiatric drug and you come off of it, you're supposed to have a period of at least 2 to 4 weeks that you wash out from that drug, where it gets out of the body, out of the bloodstream, before you add on another therapy. That is never done. Practically, doctors never do that.
And I can say from personal experience with my mother, when she was going through her journey with psychiatric drugs, it was that exact thing that you're describing. She would be on some drugs, there would be adverse reactions, watched her go from a coherent person into one of these patients that you see in the psych hospitals where they're just not coherent, not aware. I saw her lose all of these faculties that she had. And then at each point that there was any change in the medication, it was always adding of a drug.
Right.
Adding a new drug. And I even, from my perspective of not even being a doctor, went, well, wouldn't that make it hard to know which drug is causing which symptoms if you don't give that, as you call it, a washout period So yeah,
exactly. And then one drug can potentiate the other drugs. When drugs are used in combination, they potentiate one another very frequently, which means one drug will make the other drug stronger. So instead of having maybe 2 times the amount of drug in your system, now you have 10 times the amount of drug in your system because the other combined drug has caused that potentiation factor. So I knew that, and I knew I should have had a washout period, and I knew that when they doubled the dose that the symptoms became more severe. That logically said to me, and of course my logical mind was out to lunch at this point in time, but that logically would have said to me that I was having an adverse drug reaction. But that was not what my doctor had been indoctrinated to believe. My doctor had been indoctrinated to believe that I was not responding to the drug, that it was my own physical, personal biology that was the problem, and not the chemical entity that he had instituted in his therapy.
Wow.
And that is what I really spend most of my time trying to educate people about, to be quite frank with you, is informed consent. You cannot give informed consent if you are given disinformation.
Right. If you're not informed in the first place.
And if you think that you're given information that's correct and it isn't. So that's what I'm saying. You may be thinking you're giving informed consent because you've been told something. But if you're not given the correct information, and these people are not knowledgeable that are prescribing the drugs many times, and someone will say, well, a psychiatrist should know what they're doing. Well, yes, a psychiatrist should know what he's doing, and more than likely he or she does. But that doesn't mean that their intentions are all good. Because what I also came to realize because having called on psychiatry is that they are now a profession that only does drug therapy. They're only doing biochemical intervention. Therefore, if we prove that biochemical intervention is not the way to go, we are going to have a whole profession of people that will be out of business and out of a job.
And I think another important aspect of that equation, because I hear that argument as well. Well, psychiatrists know what they're doing. Psychiatrists know about the drugs. But I can't remember the exact statistic, but a large percentage of psychiatric medications are actually prescribed by general practitioners.
More than likely these days, yes. And that was where I was going with this. That was my lead in to the fact that now you not only have psychiatrists prescribing these products, but every general practitioner and his brother is prescribing them, as well as pediatricians on occasions.
Right.
So, I mean, you have a vast group of individuals out there that have not only not been educated on this, on these drugs, but they haven't really had the experience that psychiatry has to even see how these patients respond on these drugs, to identify an adverse event, to be able to put their finger on the fact, because what happens is with psych drugs, the adverse events mimic the very things that they were given the drugs for to treat
in the first place.
Exactly. So that's why it was, every patient that has an adverse event comes back saying, well, you're going to be on the drugs for the rest of your life because we thought you were depressed. But now that you've had this, manic reaction, we've recognized, just like they told me, this is part of a bipolar spectrum disorder. And now you're going to be on these drugs for the rest of your life. And if you buy into that, you are. Because these are brain-damaging therapeutics that long-term will ensure that you are a lifelong customer for the pharmaceutical industry. You will not have one diagnosis. You will have a whole book full of diagnoses by the time your life is ended. And your life will be truncated by 25 to 35 years.
Wow.
Count on it. If you're on one of these drugs. And I say that not to scare people. I say that to inform people. I'm not trying to be a sensationalist about this, but I am trying to get people to understand that it's time to confront this situation. We have a society that is over-medicated, but not only are they over-medicated with drugs for everything that you can think of, they are mind-altered because of psychotropic drugs, and it's causing a severe problem in society that has to be addressed.
Definitely. I'm definitely in agreement with you. So let's just return back to your maybe more personal story and your personal experiences. So you were in the pharmaceutical industry for several years and then receive your own mental health diagnosis, commencing your journey as a patient.
Yes.
Was that the turning point that ended up being the reason that you got out of the pharmaceutical industry after experiencing it for yourself?
It was part of the reason that I got out of the pharmaceutical industry, but actually it was my total disillusionment with the job and the profession overall. And then it was also the fact that I was damaged to the degree that I really couldn't do the job properly at that point, because it was very high profile and very stressful. Right. And so, I mean, when you have an anxiety, because these adverse events left me with a chronic anxiety disorder. So I was constantly combating anxiety at that point because, as I had mentioned previously, I had been on benzodiazepines prescribed for me for anxiousness, previously. And I had been on those off and on for a period of 10 years. And then when I instituted the antidepressant therapy, that's when I had the adverse event. Okay. So no, it wasn't like that was the thing that made me speak out and become an activist. It was the thing that destroyed my health to the degree, and my psyche. I just wasn't the same person after this event, that I wanted to get out and I wanted to do something else. And so that's when I went into natural health and healing, because that had been my course of study and my research, trying to help myself and trying to find my own path of healing. And so I thought, well, this is something that I can utilize my sales training and all of my, medical knowledge and anatomy and all of that, and be successful in doing this. And that's why I went on to do that. At that point in time, I had no intention of being an activist. I had no intention of speaking out against the pharmaceutical industry, because quite frankly, you sign a confidentiality agreement when you work for one of those manufacturers, and speaking out against them, you will forfeit all of your benefits, all of your retirement, all of anything that you have. Wow. And at that point in time, I hadn't planned to do that. Okay. I had just gotten out of the industry with my tail between my legs, barely healthy enough to go out and work a full-time job for anyone else. And I was just wanting to walk away from that experience. But after I had been out for about 4 years, and my niece, who was 20 years old, was attending Indiana University, and she was a pre-med student there. She was in a car accident and was prescribed hydrocodone, Vicodin, which is an opiate painkiller. And she was taking the drugs, and they were causing her such severe sedative properties that she wasn't able to study. So she was trying to pull an all-nighter with some friends to study for an exam the next day. And she went to a local health food store and purchased some ephedra, which is a stimulant. She took that concomitantly with her drug and had an adverse reaction. And she ended up in a local hospital, and they labeled her as bipolar and started giving her the whole gamut of antidepressants and mood stabilizers and antipsychotics and all of that. And then she became a mental patient. And I'd like to back up and just say that part of the problem of being labeled in the first place is that those labels go into a medical history, a familial medical history, so that when additional family members who may have the same predisposition to having adverse events, just like I did, because if we're genetically related, we can have some of the same genes, then those individuals will automatically be labeled when they come up symptomatic because of their relatives. So she had mentioned that she had an aunt who was bipolar, etc.
And they said,
oh, exactly. So no one even entertained the idea that she was having an adverse drug reaction. And of course, because she was toxic, that was the reason she was having the event. And when they added additional drugs, she became more toxic and she became more seriously ill. And at one point, she then got a schizophrenia diagnosis instead of a bipolar diagnosis. And she was on a cocktail of almost 14 different drugs by the time that it was all said and done. Wow. So she had to drop out of school. She was unable to work or to really have any kind or any semblance of a normal life. And eventually she came here to Texas to live with me. And she was trying to get off of her drugs. She was detoxifying. She was doing everything that she could naturally. And because she could not overcome her paranoia and she could not heal quickly enough, my sister was advised to have her put back on drugs. And so my sister called her one day and told her that she had to do something about this. She had to take care of it, and that she had made an appointment for her and that she was taking her back to the psychiatrist and she was going to go back on drugs. because I'd like to back up and just say that if you don't slowly titrate or slowly wean yourself off of a psychiatric drug, you can throw your body into a complete tailspin. And this is what had happened to my niece. When she determined that it was the drugs that were harming her, she stopped taking them cold turkey.
Oh my.
And she went into an absolute psychotic tailspin. And so that made it much more difficult for her to detoxify and to, self-regulate down the road. So she was struggling and continuing to struggle with depression and paranoia. She couldn't even go to Walmart or anything and feel comfortable. And so my niece was told that, my sister was coming to get her, take her back to the psychiatrist, have her put back on drugs. And she decided that she wasn't going to do that. So she first tried to hang herself. She fashioned a rope from her shoelaces and she tied it to a ceiling fan, and she tried to hang herself, but she was unsuccessful because the weight of her body pulled the fan out of the ceiling. So in desperation, she walked into her younger sister's room and she took an oil lantern, poured the oil over herself and ignited it, and she burned herself alive. It was at that point, it was at that moment that I knew that I had nowhere to go but out with the information, that my life's journey, my experience, my knowledge, my profession, my education, all of it had lined up to make me a credible witness and to make me a credible way shower, to explain to people what had happened to my niece, what had happened to me, and what was happening to them. Because the biggest thing that really bowled me over, the thing that I didn't anticipate when I wrote my book and I started speaking out about this subject, was how many victims there were. The vast number of people who had had this experience that I had was it was mind-boggling. And the number of people that were desperate for help, that were turning to professionals, that were turning them away and telling them that there was nothing they could do, that they didn't know how to detoxify people, that they didn't know how to help people get off of the drugs. They were given a life sentence the minute they received that label and that diagnosis, and they were never allowed to try anything else. There were no alternatives that were recommended. There were no other options for these people but to continue to take these toxic chemicals and to become less and less of an individual. They lose their sovereignty spiritually. They lose their rights as citizens. They lose their cognitive abilities. They lose the frontal lobe capacity to think, to create, to be what makes us human. And those were the things that I knew I had a moral responsibility now to speak out about. So that was my turning point. When I lost one of the most beautiful people that I had ever known in my life, I made it my life's goal to explain to others why it had happened.
And it sounds like the turning point for her was hearing that she was going to be taken back into the mental hospital.
It absolutely was the turning point, because we had gone to court and everything to try to get her to be able to legally be off drugs. And the court had granted her permission to not be on drugs because she'd been mandated. I mean, once you're told legally by the court, you have to be on drugs, then you have to stay on drugs until the court allows you to get off. And she had gone through that process and had been allowed to get off the drugs, but then she wasn't able to heal quickly enough. And of course, my sister did what everyone does. She deferred to an authority figure. She didn't know what to do, and she asked someone else, and she took that advice and ran with it, and it cost her her daughter's life.
You touch on something very important, which is this is not only your story. This is something that people are experiencing at rates higher than I think anybody would like to admit. Simply on the Psyche Truth channel alone, there are several people who have shared very similar stories as that you were sharing. What would you say to the people who say, but the drugs work for me?
Well, the first thing that I would say, I would validate them. And I would say, I understand why you feel that way, because they do work initially for many people in terms of alleviating symptoms, okay? But we're talking about short-term usage. We're talking about crisis intervention. Because if people were to do their due diligence and do their homework, they would realize that the vast majority of psychiatric drugs are only tried for 4 to 6 weeks in terms of their clinical trial duration. Mm-hmm. And people aren't placed on these drugs for 4 to 6 weeks. People are placed on these drugs for 6 months to a year minimum, usually. Mm-hmm. And generally, once they've been on them that long, they will develop some sort of dependency, or they will become addicted. And then they are a lifelong patient. Because as I explained earlier, long-term use of the drugs can exacerbate the very symptoms that they were given the drugs for in the first place. So where someone may have been initially anxious and given an anxiolytic, after you're on an anxiolytic such as Xanax or Valium or one of the other anxiolytics that's on the market, long-term, you can develop panic attacks. You can start to have anxiety between doses because you're addicted to the medication. Mm-hmm. And people do not realize that this is the agenda. I was in this industry. I have done my homework. Mm-hmm. I do not do anything else but from 8 to 10 hours a day, I am online and researching and looking into clinical data and doing the homework that other people do not have the ability to do because they don't have the time or they don't have the interest. But I have both. Mm-hmm. And I've done that homework. And what I'm trying to warn people about is that this is an agenda that is a profit-making agenda. Mm-hmm. And they know that there are no scientific tests that are required to diagnose a person with a mental illness. All it is simply a third party's observation of your so-called maladaptive behaviors. Mm-hmm. And that individual is going to take those symptoms and match them up in a diagnostic manual that tells them that means that I have this or that disease state. Right. It is not a disease state. These are disorders. These are disorders that are voted upon by psychiatrists in a forum. These are not diagnoses that are scientifically proven by a CAT scan, by a blood test, by a urine sample. There is no physical scientific evidence. That makes it extremely easy for the pharmaceutical industry and the rest of the allopathic healing community to collude for money-making purposes. So if you think that they work, then that's fine. They do work for you. They work for you short term, but you are not everyone. Right. And there are a large number of individuals that will not even get short-term relief from the drugs, that will respond and react almost immediately to these drugs in a very severe way. Right. So that individual experience, they should feel fortunate that they did get any sort of benefit from the drugs. But I am forewarning them that long-term, they will be getting on my website, or they will be getting on your YouTube channel, or they will be looking for information down the road somewhere else when they try to undo the damage that has already been done.
Thank you so much for your time today.
Thank you for having me.
Thank you for joining us. Please be sure to subscribe to the Psyche Truth channel and visit thetruthtalks.net to see more of our future videos. If you would like to learn more about Gwen, I highly recommend her book, Confessions of an RX Drug Pusher. You can find it online and in the description of this video. I highly recommend that you check out her book, check out her website, and please be sure to tune in again to the Truth Talks. Thank you so much for watching.